Has hitting 40 tanked your metabolism? Have you done everything right and yet the scale won't budge? If you're like many women, you're exercising more, eating less, and nothing is working like it did in your 30s. So let's talk about the ways that you can actually beat the menopausal belly fat and improve your metabolism. And I bet you on these tips, number 7 is going to surprise you, and you're probably doing the opposite of this. I'm Dr. Jen, metabolic and hormone expert. If you like this content, please subscribe and leave comments for me to make future videos. I'm always happy to add on to these and whatever you are hoping to hear. First of all, let's talk about that. Actually, before we dive into the tips, a lot of people don't realize there's 2 different types of fat. There's visceral fat, and that's the fat that kind of lines the inside of your belly, kind of bathes your organs. And then the subcu fat, which is more of what you can feel, is kind of our love handles that people start noticing change in your 40s. And visceral fat is actually very harmful. Predisposes you to long-term having heart disease, diabetes, obesity, even cancer. So having visceral fat lower is important. It's not just focusing on what you can actually see or feel, but it's also internal fat. And with every one of my patients that I see related to weight loss in midlife, I always do something called a bioimpedance scan, because I actually want to know how much of their body is muscle mass, how much is skeletal mass, how much is fat, what's their visceral fat. And I try to aim for having their visceral fat level below 10. You can even do this at home. Believe it or not, there's actually bioimpedance scales that are really inexpensive. You can have at your own home and help track. And that's one of my tips that I'm going to talk about too. So let's dive into those tips. Number 1, protein, 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 protein. I don't think I can say this enough, but did I say protein? Protein. So you need to make sure you're having at least 30 grams of protein every meal. You lose muscle mass as you age. You're literally losing muscle mass. And so we have to get that back, and we need it in the form of amino acids that are in protein. So protein, actually improving that macronutrient, will actually help you overall with not just losing, replacing what you're losing from muscle mass, but also you tend to eat a little bit lower carb. And I don't mean keto, I mean on the lower carb scale when you tend to focus on protein. I personally use an app called Chronometer, which helps me track what I'm eating. And I don't track it all the time because it's too complicated. It's too much work for me. Maybe fine for you, but I don't like to track and keep track of it like Weight Watchers. I just want to know in general what are the types of meals that I tend to eat over and over again, and how much protein do those contain. And I aim for about 30 grams of protein per meal. Number 2, smart strength training. So strength training that you're doing resistance training. It can be lifting weights, which I personally think is the best option, lifting heavier weights. It can be resistance training in the form of resistance bands. You could even be doing Pilates, things that are actually building muscle mass. So smart resistance training that works into your schedule. You don't have to throw out cardio. You don't have to forget about our cardio days that we loved back in the 80s and 90s, but we do need to make sure that we're focusing on resistance training in addition. Number 3, make sure that you focus on your gut. In fact, fiber is one of the most important things you can do. Is if you literally didn't track anything else, didn't care about protein, didn't care about carbs, and you just focus on trying to get 25 to 35 grams of fiber a day, it would go so far when you're talking about weight loss. That a lot of women typically get around 10 grams, including myself, until I was actually paying attention to this. And most of the time, if you can't get it in dietary form, you need a supplement. And there are a lot of different options that have both soluble and insoluble fiber in them, making sure you're getting 25 to 35 grams of fiber. Number 4, sleep priority. I know I said this before, and I'll say it 100 times. If you're not sleeping, you're not going to lose weight. You have to get consistent good sleep. Sleep helps regulate our cortisol, which can derail our hormones, which can cause us to gain weight. So it's really, really important that you're prioritizing sleep. Most women need between 7 and 9 hours. Not everybody, but most people need around that. So making sure you're getting good quality sleep. And for some women, that means hormone replacement therapy so that they can actually sleep through the night. I personally am 47 years old, and I need progesterone to sleep through the night to get back to where I was 5 years ago. So whatever way that you get adequate sleep is important, but don't forget about it, because you really can't lose weight without having good sleep. Number 5, one thing I note, and I think this is going to surprise a lot of people about this one, is that I'm a big fan of what's called reverse dieting, which means you're not taking away things. So we tend to think about dieting where you go down to, say, 1,000 calories, and we stop eating certain foods because we want to restrict our calories. And I'm not saying that calories are not important. I'm just saying that they're not everything. And so I tend to focus on how do I add things to my diet and not subtract them. So reverse dieting. This is the one I thought you would be a little surprised on. So in other words, I mentioned protein and fiber. So instead of going the standard thing, which is to take someone and say, okay, your basal metabolic rate is 1,200 and I want you to only eat 1,000 calories so you're in a calorie deficit. I don't really work that way. What I do is talk to patients about how do we add things in that you're missing. If you're not getting enough fiber, let's focus on fiber into your diet. If you're not getting enough protein, let's focus on protein. So how do we kind of reverse diet and not feel like we're restricting? Because for most women, they end up eating a lot less and they're actually becoming low in nutrients. So reverse dieting is another great tip, trying to figure out what are you missing and how do you add that back. Next is smart eating window. So a lot of people have heard of things like intermittent fasting. Intermittent fasting is just that you're restricting your eating window to, it could be 6 hours, 7 hours, 8 hours, anything beyond 12 hours where you're fasting for 12 hours and then now you're restricting is called intermittent fasting. So some people do intermittent fasting for 13 hours, 14 hours, 15 hours. The most common is 18 hours and 6 hours of feeding. So making sure you're restricting yourself from a smart eating window is important. I think every single person should have a 12-hour window where if you stop eating dinner at 8 p.m., you don't eat anything till 8 a.m., 9 p.m., 9 a.m. So you need a 12-hour window to help your liver kind of clear up that excess glucose, break down storages if it needs to so that you don't gain weight and really allow your body to heal. So I'm a big fan of intermittent fasting. In fact, one of the best gurus to listen to if you love intermittent fasting and you want to learn more about it is Dr. Mindy Pelz. She also has a fantastic YouTube channel. And I would suggest, and a great book, her book is called The Menopause Reset Diet, which is fantastic. So if you're looking for resources, I'll put that in the comments. Great book on just lifestyle techniques related to weight loss after 40. So smart eating window. So minimum of 12 hours. If you can go to 18, great. And you'll just have to see what works for you. How often do you do it? It really depends on how it makes you feel and what makes sense for your schedule. Okay, so number 7, progress tracking. So I'm a big fan of, instead of looking at the scale, standing on the scale and getting your weight, to actually do measurements. So get a tape measure and measure your waist and measure your hips. And really understand what is your waist to hip ratio. And that will tell you so much more about the fact that you're losing visceral fat, which is the dangerous fat, and so much more about how healthy you are than just a number on a scale. Because remember, muscle weighs different than fat. And so it's more important to know how healthy you are and what is your visceral and sub-Q fat and your muscle mass than it is to know a number on the scale. So progress tracking. And there's a lot of different ways to do that. Some people just literally do measuring tapes. Some people measure it through doing a bioimpedance scale, but tracking your progress is important to know where you're starting from and where you want to go. Number 8, hormone replacement therapy. Now, while hormone replacement therapy is not a weight loss drug, getting your hormones restored back to where they were, say in your 30s, will help with weight loss after 40. So if you need hormones because you're now perimenopausal and menopausal, then hormone replacement therapy can do so much for getting your hormones back in gear, which then helps control those other hormones, because it is kind of a domino effect. When you have your estrogen, progesterone that are going down, it affects insulin, it affects ghrelin, it affects leptin, it affects cortisol. So putting those hormones back and restoring them will help you long term. Along that same lines, I'm a big fan of smart supplements, especially ones that really are about muscle building. So using creatine powder, using omega-3s if you're not getting it through diet, taking fiber, B vitamins, vitamin D. So I'm a big fan of using supplements if you're not going to get it through diet. Diet is always a priority. Lastly, tip number 10, as we age, there's something called inflammaging, where the inflammation that occurs in our body from these sex hormones that go down really cause a problem with inflammation throughout our whole body. And so anything you can do to lower inflammation will be beneficial for weight loss. So that can include an anti-inflammatory diet. It can include taking fish oils to lower inflammation. It can be decreasing your stress. It can be making sure you use clean beauty products on your skin. Anything that lowers inflammation, even reducing toxin exposure. believe it or not, using glass containers instead of plastic containers can be beneficial for lowering inflammation. So anything that lowers your inflammation will help you long-term to do better and to lose weight over the age of 40. So I hope these tips were helpful to you, and let me know if you have any questions or anything you want me to further expand upon. And again, I'm so excited that you guys are all here, and I hope that you subscribe and share this with other ladies.